This morning in the news, I shared with you the fact that over 3,000 cholera cases have so far been recorded in the Greater Accra region alone. 16 deaths have also been recorded in just 1 week. 16 in 1 week. The Ghana Health Service says that we should all practice good personal hygiene. I think that this heartening thing about this whole cholera outbreak, especially in 2014, is the fact that we're not being hygienic. That is all. That's why the outbreak is here. If we're talking about 3,000 cholera cases in the Greater Accra region, then there's one organization that we all have to pay attention to, and I think recently we've been focusing on them. I'm talking about the Accra Metropolitan Assembly. Well, the chief executive of the Assembly, Dr. Okuvandapoy, has ordered the establishment of a 5-member task force in all the electoral areas of the Accra Metropolitan Assembly to tackle the city's poor sanitary conditions. Now, the task force, he said, would be headed by Assembly members, representatives from the District Cleansing Officers Unit, District Environmental Sanitation, NADMO, and the Unit Committee. Government last week launched a cleanup exercise in the wake of the cholera outbreak, which has claimed some 20 lives here in Accra. All right, so we're talking to the AMA this morning. Samuel Podo is the Chief Environmental Technologist at the Accra Metropolitan Assembly. Mr. Podo, good morning to you. Thank you again.
Yeah, good morning, Mama V, and thanks for the opportunity again.
Yeah. So this cleanup exercise that was launched, how is it going, first of all?
Yeah, I think so far the cleanup exercise that was started about last week on Monday has been very successful because you've managed to remove all the heaps of refuse that we identified. I think we identified about 15 heaps. We've cleared all with other additional areas, and for that matter, I think the cleanup has been very successful.
So you saw the heaps? You saw them forming?
Yeah, we saw them developing.
Why did you leave it for such a long time?
Yes, I think the situation has been that we faced the problem of a dumping site and then inadequate logistics, like, you need transport vehicles to collect the heap. And for this occasion, you have to actually call on a company, Zoom Lion Ghana Limited, to actually bring on board a lot of equipment into the system. And for that matter, we were able to clear all the heaps, and the cleaning is ongoing. And also, we managed to get a new dump site at Nsumia, which is on the Nsam Road. And the traffic situation on that road is better. And for that matter, a lot of waste is being transported to that place. And so the current situation is not too bad. It's good.
Okay. Let me just quickly go to the phone line and engage Dr. John Eliza. He's the Greater Accra Regional Deputy Director of Public Health, and he will be joining us with some details there. Hello, good morning, sir, if you can hear me. Thank you for your time this morning.
Good morning.
So I'm looking at the cases that we've recorded, 604 so far, am I correct?
Sorry?
I'm saying that the cases that we've recorded, the cholera cases we've recorded, 604, yes. Correct?
604, no.
Okay, so what's the correct figure?
As at close of yesterday, we had 3,600 cases.
Okay, yeah, but I'm trying to break it down. 74 new cases, I think, yesterday, no, on Monday. Since the beginning of the cholera outbreak in July 2014, a total of 604. That's what I meant. Sorry. Hello?
Hello?
Okay. So we have 8 deaths, or has the number gone up?
Okay, you are far behind. You have 38 deaths as of yesterday. That's what I said.
Oh, okay. So I'm far behind. Yeah. So is it getting worse? Because that's what the figures show, right?
Yes, the numbers are increasing, but for a reason. When the outbreak started, I realized that the reports we were giving you, I always mentioned that we're having it only in 4 districts. Then, we have 16 districts in Greater Accra. So, as we speak now, almost all the 16 districts are now reporting. And that's why the spread now wider, and that's why the figures are getting bigger and bigger, because it means people are interacting and then spreading the disease among the others who initially were not part of the districts that were reporting.
Would it get worse?
I don't think so. With the measures we are adopting, I don't think it will get worse. Maybe we have gotten to the peak. We have to start declining now.
So what measures have you put in place? Because if the measures have been effective, should we still be recording higher figures?
Yeah, we'll record higher figures before it starts coming down, because from the word-go, the few who actually had clinical signs of cholera and came reporting might have had contact with a lot of other people who were actually incubating then. So most of them who did not alert us for us to do the prophylaxis will also have a full-blown cholera, which is what we are seeing. After that, if people develop good personal hygiene and things, then we expect that the cases should start coming down. But let me also caution that the mere fact that you have just recovered from cholera does not give you immunity against cholera. If you go back to your old ways, which led you to get infected, you will still get cholera and come back. So rather, some of these figures we are talking about, some are people who have had it earlier on, but went back again and to the same environment and doing the same things. And some, you realize that if you watch the analysis we are doing, you realize that most of the cases are coming from the same households, because the contacts are not being given prophylaxis.
So, Doc, is it still the same issue about hygiene? Is it personal or something more to that? Because it's unbelievable, really, that in 2014 we should be recording very high figures of cholera.
Yeah, that's the shameful aspect. But you see, let me just tell you, it's the same environment. You see, cholera is a developmental issue. The environment in which you are makes a big difference. If you observe critically, our typical rural village areas, they don't get cholera. Because go there and look at the environment in our villages, very clean. And you realize that in those places, you hardly see people shitting indiscriminately in those communities. So that most of the time, if you observe, cholera is in the big towns, and especially along our coast, where people think that they must defecate at the coast to get the breeze of the air while they are, the breeze of the sea while they are defecating. And so if you watch, you realize that our coastal belt is usually very hard hit when we have cholera outbreaks. So if we improve our environment.
But Doc, you know, we started making a lot of noise not too long ago about the fact that there were a lot of refuse. We had problems with where they dumped the refuse, for instance. We didn't hear the Ghana Health Service come into the picture. It was more of, you know, like a media battle. It was just the media talking about it. And I'm thinking, this is the effect of it, right?
Yeah. The issue is this. What we are having now is not the result of today. It's the result of what prevailed before we are here now.
So where is the Ghana Health Service when those things are building up?
Sorry?
I'm asking, where are the rights officials? I mean, because if it's not the media and the ordinary persons talking about it, and it's the Ghana Health Service also making noise about the fact that, you know, there are refuse everywhere, it's not being collected, you know, the effect will come to haunt us one day. We didn't hear you say much about it, you know, when it started. That's what I mean.
Still much about what, excuse me?
The refuse that was building up in different places. I mean, today we're talking about cleaning up. But before the cleaning up, what did we do?
Yeah, let me just maybe use this opportunity to clarify an issue. Ghana Health Service has a certain specific mandate. And we have other sectors who are responsible for that. This refuse you are talking about, we're building up. Somebody is responsible for sanitation. That's why we have a sector like environment. I'm sure you are aware of that.
Yeah,
so those are the people you should be talking to about why they didn't clean up, or why did they allow it to do this. You realize that somewhere in May, we started talking about the fact that looking at the kind of refuse we have in our in the city, if we don't take care, we are going to have a major outbreak of cholera. And we started alerting the people the things they should do and what not to do.
Okay, so Dr. Lisa,
it's because it's the media we use to do this. So I was expecting that then the media should have started asking those who were responsible for clearing garbage why they have left the garbage.
We did, Dr. Lisa. We asked a lot of questions, but I do have the chief environmental technologist with the AMA sitting right here. So just hang on for me because I want him to address that. What did you do? Because I think that was the question I came to just before Dr. Lisa came into the picture.
Yeah, I think...
why didn't you do it before we got to this point?
Yeah, I mean, I should say that normal work for collecting waste was ongoing, but then we had some logistical problems, the facility to dispose of the waste.
But you see the cause of the logistical challenges?
Yeah, we saw it.
You see the effect of it now. Over 3,000
yes, one clarification is that solid waste, for that matter, refuse, never burns cholera germs. It is fecal matter. It is the fecal matter or nice soil or liquid waste that actually harbors, cholera germs.
Dr. Lisa, is that really the matter? I mean, is that it?
Yes.
I didn't hear him. What did he say?
I was saying that cholera virus or cholera germ is harbored in fecal matter and not solid waste. You say, but for attitudinal change, people are mixing fecal matter with solid waste. And for that matter, it is possible that we can get contamination from that source. You say, we are talking about refuse. But cholera germ is always in the fecal matter.
Okay, so it's not exactly, Dr. Lisa, it's not exactly an issue of refuse?
Let me clarify an issue. I've always said that the true fact of it is that when you get cholera, it means you have eaten feces that have been contaminated with cholera bacteria. And I've explained that people are shitting indiscriminately. And when the floods come, the floods mix up this, sweep them over the gutters, the sewage system. Some of our pipelines are broken. The sewage from the various places mixed up with this flood, and our tap water gets contaminated. Let me just give you a hint, though I've not officially disseminated this. When this cholera started, we've considered a team from our School of Public Health to investigate the possible sources of the current outbreak. The preliminary results have shown that a lot of the people that are getting contaminated from the sachet water that we are using that is being sold on the streets, because we have tested it. The other issue is that another huge percentage are getting infected from the food that they buy from the roadside. These foods and water can only be contaminated when the source of it. That's why I said that you should talk to those in charge of the environment and water and sanitation, water and what do you call it? Those in charge of provision of water. So, if we are not having clean water and the environment is full of feces all over the place, which, like you rightly said, you see that people are bagging people shit in rubber bags and put it in the refuse. So you can't say entirely that the refuse that we have there is not the source, because some of the things that are put there should not be there, but that's why they're keeping them. And those are the sources of the contamination we have.
Okay. Dr. Lisa, we'll have to leave it here. I think it's really important what you said about the sachet water, because I thought that was, and a lot of people think that is the best choice. But if we can't trust the source of it now, then that is scary.
And that's the fact, because we were trying to look for possible source, the rate at which it was coming. And we found out that it's one of the sources in addition to the food vendors. So
we'll talk more on the sachet water issue, but for now, thank you for your time, Dr.
You're
John
welcome.
Lisa. He's Deputy Greater Accra Regional Director of Public Health, joining us with some details on the phone. But of course, I do have Mr. Kudo here with the AMA. I mean, it's scary. You were putting dustbins and saying you can put solid waste here. What happened to that classification? Because I haven't seen bins that have been classified these days.
Yeah, I think for months now, some months ago, the AMA actually distributed almost 10,000 bins in Accra. And by law, every household is supposed to own a bin. And since we actually implemented our polluter pay system, our public health officers have been enforcing that residents or waste generators should own a bin with a tight fitting cover to avoid flies, so that they can store their waste and then make it available to the AMA, and for that matter, its agents like the solid waste contractors to pick and dispose of.
But
so bins are actually a very important facility for every household to actually generate waste and put, deposit the waste in the bin and with a cover, and then it's picked at the appropriate time.
What happened to every household having a toilet facility? That particular project that the AMA had initiated.
Yes.
Because if people are putting their toilets in the household bins, then I mean, and you're saying is a mixture of the two.
Yeah,
that is
true.
causing this.
Yeah, that is one negative attitude that is emerging in our system now.
Yeah, but if I don't have a toilet facility,
if
I don't have a toilet facility in my house, what should I do?
Well, you must have it by law, by the building regulation. Every house must have a toilet. It's an offense not to have a toilet. But if you do not have a toilet,
who gives the permit
for toilets?
No, to build.
To build toilets?
No. If you're building a house.
Yeah.
Or these days there are a lot of old houses.
Yeah.
But is there some sort of inspection, some regular inspection that goes on?
Yes, for building a house with a plan, is the AMA that gives permit in consultation with town and country planning and other stakeholders. And that permit is given with an inspection to ensure that there is a toilet, there is a bathroom, there is a kitchen, there are all the facilities in the house.
So it means that you failed then, because if your job is to ensure that all these things are in place before a complete house is put up, and there are houses that still do not have these facilities.
Yes, Mama, let me tell you, Accra is expanding, rapid urbanization, and you find a lot of squatters in Accra who are in a kiosk, and at open places, and people are even sleeping in the open. And these are the people, we call them floating population in Accra. They number about 2 million in Accra, and they are in all the communities. You go to airport residential area, they are there. You go to cantonments, they are there. These are people who are infiltrating into our communities, and they don't have toilets. And these are the target group who are actually involved in packaging fecal matter in polythene bags and putting them at wrong places.
So
that is the challenge.
But you see,
it's not people with a self-contained house or with a house, block house, but some of them do not have.
So why are illegal people still in places where they're not supposed to be? I mean, it's fantastic. You know where they are. They are in airport, for instance. They are in cantonment. I mean, they are here in Kokomilimle. So we know where they are. We know that they're living in kiosk, which is unacceptable. So why are they still living there?
Yeah, Mavi, you know, for every city we have slums, but it is everybody's responsibility to ensure that you are at the right place and then you have the facilities to use. Because in our villages, like the doctor said, it's a small community, but they have a particular place where they use. And you cannot even go and defecate in the open in somebody's backyard. Because they know you, they know your father, they know everybody. So that when you do that and you are spotted, you will be punished. So the slum is a social problem.
No, but you see,
facing,
the AMA is the Accra Metropolitan Assembly. I mean, you control, as far as I'm concerned, I mean, when it comes to Accra, the mayor is more powerful than the president. I mean, he controls the city.
Yeah.
And so if there are issues, I mean, you know the problems, you know the challenges. Why do they still persist? And you're cleaning up. Remember, the people living in the kiosk, the people living in places where they are not supposed to be, the people living in places where there are no toilets. You're not clearing them up. You're cleaning. The people are still there. It means that the mess will happen again.
Yeah, the fact is that, talking about our mayor, he's been involved in decongesting this city all the time. But sometimes, you know, you have to use human face in dealing with some of this, and also maybe to educate people to do the right thing. And education takes some time for you to persuade somebody to change.
We're measuring the AMA by the outcomes. I mean, this is it.
Yeah, the effect of cholera.
Exactly.
It's more.
So it means that he really hasn't been doing anything.
Yes, it's more of the attitudinal problem I'm talking about. For instance, the doctor was speaking about where it's coming from. Sometimes even houseflies, common houseflies, are able to pick cholera germs to your food, especially when you are not eating in an enclosure, or you've not washed your hands. Or maybe if you have a patient in your house, and that patient is rushed to the hospital, the beddings and those facilities that the person has used, the chamber pot or whatever, because the person is running and vomiting. So those things must be carefully handled by disinfecting them with Izal or Dettol before disposing of. But maybe they're just throwing it elsewhere, and the flies, you know, approach such places and bring the germs back. And that is the problem that we're having now, and that is causing the spread. It's until houses, for every cholera patient, one patient, there are several people who are involved, who may be contacts, and may come after some time. That is the effect we're having now.
So this cleaning up exercise, is it permanent? Is it permanent, the cleaning up? I mean, would you always be waking up to be sweeping and
well, that is our responsibility. Don't you see the Zoom Lion guys sweeping the streets every day? In fact, you drive around even the ceremonial streets of Accra. You don't find fault. You just, I appreciate that Accra is clean. You say it. But when you go into the communities, that is where the problem is. And that is where people are using public toilets as extension of their homes, and then lining up and overloading the public toilets. But the enforcement, our Metro Public Health Department is issuing notices to even people who have latrines to change them, convert them into WCs and other types of toilets, because this is the place that we're having the flies visiting and coming. So provision of toilets in homes are increasing now, because this project started in 2010.
But you know, and that's what I'm probably failing to appreciate, because if provision of toilets in homes, you say they are increasing now, why do we have a case of cholera?
I've mentioned about the slums in Accra.
Exactly, but the slum,
and they are all over the place.
That's solely your responsibility as
but
AMA.
That has been done gradually, and with the formation of a new committee at the grassroots level that we are calling Sanitation Standards Committee, which was formed by the mayor, we are going to apply basic rules of hygiene at the community level now, and not just picking the markets and where we have designated as sanitary site. Now we're going to apply it. The town council is going to work. They are going to be seriously involved in this committee to ensure that Accra is clean. And we are going to, that is a sustainable system the mayor has put in place. And
so when you collect the rubbish, the one you're doing now, your 10 days, when would it be over?
It's tomorrow.
Where do you put the refuse,
now,
what you collect?
Yes, we've identified a new dump site, which is owned by the Zoom Lion Ghana Limited, and that is where we're transporting the waste.
Still Pong?
No, it's no more Pong. Pong was a problem, you know, because the traffic was a problem and the distance. But the Sumia and Dublo, the traffic is better, and so our trucks are able to make more trips than they were doing before.
Okay, so you said this is where?
In Sumia.
In Sumia.
In the Gan West Municipal Assembly.
Okay, so this is new. It's not going to be full anytime. Are we recycling? What is it? What is the plant about?
Yeah, recycling of waste is about waste that is necessary to you. I'll give an example.
So this is a recycling plant
where
you dump them?
It's a landfill site. The recycling plant is at Ajenkotoku. That is the composting plant that will convert organic matter, organic waste, into organic fertilizer and to be used by horticulturists and agriculturists. That is also open now. It is working. But the capacity.
So are you recycling some of the ones that you're collecting presently?
Yes.
Or you're just dumping them at the landfill site?
No, we are dumping almost 70% of our waste into landfill, that is to the landfill. But recycling is ongoing. The metals are being recycled. The plastics are being recycled. So you find the women picking plastic now, and they sell for a kilo for 60 pesos. And you find them in sacks of lead going for recycling. And then we have paper. Some paper is also being recycled. So this
new landfill site, is it closer to a certain town? Because you remember you mentioned about the flies. So if this is a big place where we dump refuse, certainly there will be flies. And if it's closer to people's homes, then that should be another concern.
Yeah, one thing about the characteristics of dump site is that when you put waste in a particular place for 3-5 days, serious temperatures rise. Heat is generated. There are gases in there, and will not attract any fly or any vermin that can cause disease because the heat is so much. And that is the process of composting.
So people in the community are
so
sure
the flies will not be there, but the problem we have will be for smell, stench, offensive smell. That could be there. But sometimes if you are able to cover properly with soil, then the stench is reduced.
Sometimes. The people didn't say come and build a landfill
that is the
site
engineering.
here.
I said sometimes because sometimes we have to get soil to cover is a problem, you see. But that is the engineering we have to put in to ensure that the stench is reduced. But for vermin or germ or flies to settle on a landfill site waste, is not there because the gases coming in. It's only fresh waste that attracts, like a cholera fecal matter that is just thrown. The flies will go there. You know the behavior of houseflies.
So the very final one. Tomorrow is the 10th day, so the end of that 10-day window that was given for the AMA to clean the capital. Today before tomorrow, in terms of percentages, where are we? How clean is Accra today?
Oh, I would say we are around 70% clean. 70, we were around 40 to 50% about 10 days ago.
30 is big, and the deadline is tomorrow.
70% now.
So the 30 will be covered when?
When? You said the rest of the 30. The rest of the 30. Yeah, the mayor has actually extended the 10 days to 100 days. So we're going to sustain. That is why he has formed this Sanitation Standards Committee to ensure that our drains. Now the problem with the drains, I saw you showing some drains there. The drains is actually expensive to handle. So he's now going to get the necessary equipment to excavate all the refuse in our drains and the Kole Lagoon, and that is coming out of the Conti project that will start soon.
Okay.
Yeah. All
right, Mr. Podo, we'll have to leave it here. He's the Chief Environmental Technologist at the Accra Metropolitan Assembly. Samuel Podo, always a pleasure having you.
Thank you, Mama.
Thank you so much for being
here.
Hope
to meet you again.
So the 10 days has now become 100 days.
Yeah, because waste is generated every second, every minute.
Has he informed the Vice President?
Well, I cannot tell, for sure. I cannot tell. But I hope he's going to evaluate and then get him informed. Because he came to actually motivate us to work harder.
Okay. So there was actually a quick one I was supposed to ask you on MDGs on sanitation and whether or not we'll be able to meet that target.
Yeah, I think we should be able to do that because it's more of provision of toilets and water and other things. But I think we're going to meet it with the. That is why the Conti project is coming on board for us to be able to meet it. And as soon as that is started, I think we reach.
Our problem is coming on board.
Because it is you use money to do these things. You must get the funding to work. Waste management is expensive. The sort of equipment you have to use. It's more engineering than with a human being just carrying it in the basket and throwing away. You have to use heavy machinery.
This new landfill site, who owns it?
Yeah, it's a PPP arrangement with Zoom Lion Ghana Limited.
Okay. They are managing the one at Poon.
Yeah, they are the operators there too.
Okay.
Yeah.
All right. Thank you, Mr. Podo, for your time. From one health matter to another, my colleague Abigail Adumokoenchi went out today roving, talking to students about the postponement of the reopening. Remember that the Education Ministry has asked that tertiary institutions, both public and private, hold on to their reopening until good measures are put in place to ensure that persons are screened properly before the schools reopen. So here's her report.